Hope everybody's doing well during these exciting times. We're delighted today to have Nicole and maybe Salim. I'm just checking to see if he's appeared yet. The bad news is, Nicole, I still don't see him on yet. And they're going to be our leads today. And we're delighted because they're talking about a very pertinent topic on equity, diversity, inclusion. And Nicole, I'm going to hand across to you, if that's okay. Have you heard anything from Salim?
No, I actually email him and also test the sales office
Okay.
Pascal, and hopefully he will. Oh, he said he's on Zoom now. Did he get the right?
Salim, are you with us? But where is he?
I don't know if he's.
I don't think he made it. I don't know where he is, but
I think if you start, and I'll try to. I'm just wondering because I know two other people who were supposed to join, but I don't see their names. Is this him appearing?
I believe he's
Yes, there he is. Okay, Salim has arrived.
Oh, okay, perfect.
So with that said, we're delighted to have Salim here today and Nicole. Nicole, over to you and Salim.
Sure, good. So when Salim is preparing, I'm just going to say a few words. So I'm Nicole. I'm a faculty from SCSD. I'm also chairing the Widening Participation Committee under SACE, which is directed by Dr. Salim Razack. And so it's clear that the topic of EDI is much more important than ever now in our teaching, research, and clinical practice. So Salim is going to give a presentation on some EDI principles, and then we will have a case scenario for breakout room discussion. And then we will come back to the main room for wrap up and answer some 1 or 2 questions as well. We also received some of your EDI burning questions from the registration forms. We probably won't have time to touch on every questions. However, we have 2 specific handouts specific to effective allyship and recognizing microaggressions. And we'll post these 2 practical handout with today's session summary on the website after. So when Salim is ready, I'll pass the stage to him.
Good afternoon, everyone. I just wanted to let Heather know that there were about 25 or 30 people on the Zoom link that I was on, waiting for you and Nicole. So I think there may have been 2 Zoom links or something like that. So like lots of people, like at least 30 people. So I would suggest, I told them that I would ask you to send out the Zoom link by email. So please go ahead and do that. And can you also share the slides?
Wait, just 1 moment.
Yeah.
I'd have to get them up. Hold on.
You know, while you're doing that, maybe you should go back to that Zoom link. Somebody could do that, the other one, and actually put in the chat the link to this Zoom link.
Everybody left it because I got this email saying, "Where are you?" And I figured out that I was in the wrong place, the wrong virtual place. So anyway, I'm sorry about this, folks. Once the slides are up, we'll start. Suffice it to say that since COVID and since the events of, well, it's really been 3 major events: COVID, the killing of George Floyd and the subsequent worldwide protests, and the more recent death of Joyce Echaquan in care in a hospital that I receive patients from, not too far from here. The focus of our activities has really started to shift to issues of equity, diversity, and inclusion. And this goes everywhere from what are we teaching students in our health professions and health sciences programs, to what kind of environment are they in, to what kind of care do they deliver if they're health professionals at the end. And a bit more of a nebulous concept, and I hope to have some discussion around this. You know, how are they participating in systems of racism and systems of discrimination through concepts such as systemic discrimination, systemic racism, and what is the role of our faculty in perpetuating or dismantling those things. So I will ask for the next slide, please. I don't believe I have the capacity to switch to the slides. I'm going to ask you we're probably not going to answer these very much because we only have an hour, or probably a little less than an hour now. What specific questions, issues, or troubling situations have you encountered as a teacher, researcher, or in other roles as a faculty member at McGill University? And these are issues related to equity, diversity, and inclusion. So please respond in the chat, and we'll do a little sort of survey of the chat without really discussing it much as we in terms of allowing us to understand what kinds of things people encounter. Just waiting for some of the chat to come up. I'll give it maybe another minute or so. Not seeing much coming up, nothing coming up actually. Sexism is in older, now retired faculty. So the issue of, I'm going to say gender relations, gender relationships. There's a sense that those are evolving and changing. And then there are others who say, was it ever okay? You know, there's sort of those two sides to things. How to make people, trainees and colleagues feel comfortable, empowered in simply discussing specific or systemic racism or other discrimination in our regular work. Not being updated with the current terminology. So that's true. There's definitely a kind of a terminology thing to deal with. Fear of doing something wrong. This has come up a lot. This has come up in my meetings around curriculum. The basic thing would be, you know, I know that I need to teach this, but I also know there's a right way and a wrong way. Natalie Bottega says, I'm afraid to describe a patient's race or ethnic background, which could be relevant to a clinical scenario. Is it wrong to say that cyanosis was not seen because the patient is Black? That is like my favorite topic because I'm an intensive care physician in pediatrics. I think one of the things that I would ask, and I don't think there's an easy answer to that one, and this would be the last one that we do before moving on. But one of the things that I would ask is, when you note a patient's race, and for those of you that are doctors who write histories and physical exams and admission notes, you know, where do you note it? Do you note it in the physical exam? Do you note it in the social history? Do you note it in the history of presenting illness? Where do you note it? And where's the appropriate place to note it? I would posit that since it's a socially constructed thing, and that there's lots of evidence that really shows that the best place to note someone's race or ethnicity would, if it is to be noted at all, is in the social history. The issue of cyanosis, this has come up in my own practice because I sort of react a little when people say it's harder to notice cyanosis in a black child, because it's actually not harder. It's actually something to do with familiarity and something to do with teaching, that we need to learn to notice cyanosis in all kinds of children. So not sure what the right answer is there, but I know this tension. I think I'm going to move on to this is the slide actually. I'm going to just minimize the chat. So these are the things that I have seen asked of me. I want to incorporate anti-racist, anti-oppressive teaching in my courses, but I feel I am lacking the skills. I know there's a right way and a wrong way to do it. What about when my students end up in the hospitals or clinical placements? This is the sense that you can teach stuff in the classroom, but then they'll go, like for instance in medicine, they'll go to the the hospitals, and everything will be unlearned because there's no linkage between what's learned in a sense that there's no linkage between what's learned in the hospitals or clinical placements. How do I address representativeness in the student body when the faculty is not very representative? I feel at a loss to advise and help students who have experienced microaggressions. What are the skills of good allyship? How do I teach anti-Black racism, anti-Indigenous racism, and then gender, sexuality, disability, brownness, Islamophobia, anti-Semitism in a coordinated way that respects the histories of each and the outcomes of each? And we don't, this is actually something I've been thinking about a great deal. If there are some questions, I'd be happy to talk about that a little bit, about how I've been thinking that through. I'll leave you with one rallying concept, which is let's try and avoid the oppression Olympics as we're trying to teach these different things. So next. So definition of diversity. Human variability. So you're not going to like my definition because it may not be that helpful to you, but my basic idea is that populations are defined by something that they share. So in medicine, we might talk about the population of people at risk for type 2 diabetes, for instance. So everybody shares that risk. So the diversity of that population is simply the things that they don't share. They are different in their social characteristics of race and ethnicity, age, all these different things. So diversity is really the things that make the individuals in a population that has been put together for human reasons. Humans make populations. They categorize a population. So it's the things that they don't share, the population shares. And there, we talk about surface diversity and deep diversity. We talk about sort of the readily recognizable characteristics of a person. Like you can look at me and you can see someone who, oh my God, has absolutely no hair on his head, so he's bald, practically bald. You can recognize something. You can see that in me, and you can hear the way I talk. You could probably say he grew up in an urban environment in Canada from that. Deep diversity is actually quite a bit different, actually. It's the things that are not apparent, either because they're not readily visible or the person actively hides them, such as maybe perhaps their markers of their sexuality, markers of their gender identity, and so on. Those are things that might be deeper. Markers of their religion or religious beliefs. That might be something that is not seen. Okay, next. One thing that I did, and this is the cyanosis. This is actually the cyanosis idea. Actually, so when I went to medical school in the 80s, and you're now supposed to fall off of your seats because I said the 80s, and I look so young. When I went to med school in the 80s, we talked about the 70-kilo white male. And in fact, I always joke that pediatrics, Leslie's written the 1880s, touche, Leslie Fellows. I used to joke that the 4 years of pediatrics were really to teach me how the children were deviants, really, from this 70-kilo white male ideal. And I think that there's sort of this idea that, well, we have to classify knowledge somehow, right? But if we classify knowledge that way, we start with a normal, and then everything else is a deviation from it. And this actually results in health outcome differences. I probably don't need to let this crowd know about them, but there's a lot of gender related differences. But for instance, the recognition of MIs in with the presentation of symptoms of MIs in women versus men, resulting in health outcome differences related to this. So if we bring it back to the cyanosis picture, I think that with cyanosis, what I would like to see, I'm okay with the idea that maybe you don't see too many dark-skinned children in your practice, say. But what I want you to do as a teacher is I want you to not say it's harder to recognize cyanosis in a dark-skinned individual. I want you to say, this is the way we do it, because it's actually not harder. Because I'll give you an example. I worked for a little while in my home country of Trinidad, doing a little ICU work here and there. You know, the nurses there would like look at the children and say, you know, this kid is blue. And I'd be like, what? I can't see this kid being blue. And so it's a familiarity acquired skill thing. And I think that's the way to recognize it. So next, equity. Now this is a harder concept. I think I have one more slide after this before we break out, just to, because I know Nicole is getting mad. In terms of equity, I think what we have to do for equity is recognize that there are historic and ongoing systemic marginalization and discrimination experienced by specific groups. And what I would add to that, and this is what we don't do well in medicine, is that I think we have to understand our institutions of medicine as absolutely central to the marginalization and discrimination. Like, we would be nowhere with the colonization experience of Indigenous people in Canada if it were not for the medical system or medical systems, legal systems, and educational systems, right? So we are, we are a central part of the need for truth and reconciliation, for instance, to you in that example. And I think when you're able to, you know, and I don't know if you agree or disagree with me, and I'd be happy to entertain some questions after, but when you think of it that way, it becomes easier to understand what's your institution's role in addressing inequity. Why do we create programs? Why do we commit resources to address inequity, for instance? So that's equity. Next slide. Last slide here is this notion of inclusion. A lot of people hate inclusion, the word inclusion, because it feels like, what does it mean? That when I invite you and include you at my dinner party, do you get to bring a dish, or are you going to just eat the food that I give you? Will you know which fork to use, or is it okay if you use the forks out of order, for instance? That's an example of where inclusion can be misunderstood. But the best framework that I've seen for institutional inclusion, it comes from a kind of an organizational behavior framework. But institutions that are inclusive are able to engage in activities and policies and procedures that promote a high belongingness of their constituent members, while simultaneously respecting a high value in their uniqueness. So you're going to ask me, what does that mean? So an example of belongingness would be that at a meeting on Zoom, the chair pays attention to airtime so that many people get a chance to speak, for instance. And then valuing uniqueness, an example of that is maybe a university saying, you know, here are the 100 recognized holidays of most of the major religions that of the people that we that come to this university. And on these days, we will not have exams. That's an example of recognizing that policy that recognizes the uniqueness of individuals. So those were the next slide. So that, you know, in a quick nutshell, is really an example of the small group activities. Nicole, do we have to go to the small group activities, or can I entertain some questions now, or wait till the end?
I think it may be better to wait until the end. I think now is actually a good time to do the breakout case discussion, and Anne has some ideas about the logistic of it, right?
Yeah.
Thank you so much, Salim. This is a very nice overview, and you have lots of questions which are coming in, plus others. So I think we're going to have to follow up with part of it as well. So for the discussion, they've given us a scenario. So this is the scenario which will also be posted in your small group And for the lead of your small group this time, it's going to be, because we like to change it every time, it's going to be who has been the longest at McGill will take the lead this time. See, we did the youngest, we did the exotic pet. This week, it's who's been the longest at McGill. And you're going to be discussing you're on sabbatical leave, but have assigned a resident or PhD, whatever's appropriate, to help supervise undergrads in the lab or in your clinic. One day you receive an email from a Black undergraduate student who said the resident PhD student had been providing one-to-one training to all the undergrads that is present in the lab or in the clinic. But this particular student felt that they weren't receiving any support from that person. So how would you respond to this email from this undergraduate student, an MD student, if it's in your clinic or in your research lab? With that, we're going to go to our small breakout groups, and it's going to be the lead. So it's going to be I'm going to not say the oldest, but the person who's been at McGill the longest. Look forward to seeing you soon. So 20 minutes, Heather, and then we're back. It goes fast.
How many groups do we have?
I think we have 4.
Oh, okay. So we should have enough time for report very quick. Okay, good. So welcome back, everyone. And so we now would have the group leader to just share some pearls with us. We have around 10 minutes. And maybe group 1 first. I guess group 1 is Leah, is our group.
The group leaders can put their names in the chat to help Nicole. Bernard was the group leader in group 3, if I can put him on the spot.
For sure.
And John White was the group lead for us as well. So that's
Perfect.
the 2.
Okay, Leah.
So this is what happens when you put in a group where they all just started working last year. This is why I'm speaking right now. Actually, it was very interesting because I think the members of the group 1 expressed the difficulties that these issues kind of bring forth to all of us. But one thing was clear: we would not respond to an email with another email. We would ask, first thing that we would ask for is to have a meeting, whether it be a virtual meeting or remote or in person. But the importance is to try to also understand the origin of the feelings of the junior student. Where did this all originate from? But also not just to understand the feelings, but to also let them know that we are listening actively and we're taking this seriously, so that it is very important for us to understand what they're doing and go from there. So we spoke about the importance of meeting the individuals separately with the hopes of then meeting together as a group. And things like, for example, intentions or implicit bias were brought up. And so even if we do come to the essence of the person didn't do something because they didn't have bad intentions, it was just something that happened, we can't put aside, or we can't forget that not knowing or doing something is still harmful. So that it is our role and responsibility to let the person know that even if they didn't have any bad intentions, these things happen, so that we need to work with it and try to figure out what was going on. It's important for the person who feels victimized or who feels being put aside that they have an ally in us, kind of a thing that they can trust. And I think what was also brought up as the last point was, whether we're in academics or whether we are in the clinical world, sometimes it's difficult to understand the formal mechanisms. So at which point do we, after we've listened and after we've gotten to the essence of it, when do we bring things to another level? you know, how do we express our support without us coming across as encouraging or discouraging them from taking on the next step? So I think that's what I got out of my group, but if anybody else would like to add, please go ahead.
Good. Yeah, I think you captured the essence in the discussion. Great. Thank you so much, Leah. And then may we have John White, please, with Anne's group.
I'm sorry, I was muted. So I think we're in large agreement. We certainly did start out by saying, instead of dealing with it, you know, let's imagine you're away on sabbatical in some other country or at some distance or something, that you would not deal with it electronically just by simply sending a series of emails to try and address the situation, is to actually pick up the phone or have a Zoom and do it that way. That obviously you meet with both parties. Another issue that came up was sort of discreetly or diplomatically survey maybe one or two other people in the group to see if they actually perceive that there is an issue here, that this person is being treated differently from other members of the group, to try and establish as best as possible that in fact that there's a racial ingredient to this rather than just not a clash of personalities. Even if there's even if there are arguments that there isn't a racial component to it, I think the research assistant or the postdoc or whoever it is who is in charge of the student has to be made aware of the potential perceptions involved. I'm not sure that I would have a meeting addressing the situation directly with the two of them by Zoom. I think I would probably deal with it separately, but then probably what I would do is I would adjust things down the line to have meetings by Zoom with the student and the postdoc together to go over research aspects and things like this, and follow up with the student as much as possible to develop a sense of allyship between myself and the student. I think that kind of summarizes everything that we discussed.
Great, thank you, John. And Salim made a comment. Yes, power dynamics is something important to consider as well. Great. May we have Bernard, please,
yes,
with Leslie's group.
Thank you. So I was fortunate to have Salim and Leslie and John and Orlovsky in the group, so a lot of senior people. I think a lot of the points were similar. Some of the key points, some of the approaches are to maybe have a meeting with an entire group, identifying the responsibilities and issues without pointing the finger to anyone, but whoever is guilty would be aware that they are, but to discuss openly so that everybody is aware of what we should and should not be doing. It's an approach that John described and something similar that I've done. Another point is to put yourself in the shoes of the individual and try to understand why they feel that way. And that there are very few extreme cases of black and white. Most things are shades of gray. And you've got to really understand how somebody could perceive to be insulted or offended, and others may not understand that. And so having open discussions, but not pointing your finger to anyone is, I think, a very reasonable approach that came through. Salim or Leslie, did I miss anything that you want to add?
No, I think that captures it. I think the mix-up between kind of performance issues, say someone's got some problems, and the environment is a frequently encountered thing.
Great. So may we move on the last group, Rob, and then we will have Salim to wrap up the whole session.
Sure. So we had a pretty diverse group as well. Most of the stuff's been said already. I think first thing is you need to create a safe environment so that the student feels that they can disclose things to you. So ideally that's even done before this actually happens, but the fact that she has come forward is actually a good thing, and that should be encouraged. We have to be careful not to do more harm by intervening, although we obviously need to intervene because that could be a bad outcome. We need more information, so we need to speak to the student to find out why she feels that she's being ignored in the lab. And the presumption is that she's female and Black, and the supervisor is male and not Black, but we've not been told that at all, right? So we don't know what the ethnic or gender differences are between the two of them. And in fact, that may or may not be why she feels she's being ignored, right? So so we need to find that. We're making a presumption. We're making a presumption because this workshop is about EDI. And we need to talk to the supervisor without being accusatory, because you can't go to the supervisor and say, I got a complaint. You need to speak to the supervisor and find out a little bit about accountability, what he's doing with his time, who he's mentoring, and that kind of stuff, and what kind of questions the student is coming to him with. Because in fact, the reason that she's being ignored may have nothing to do with her race or her gender. It may be something to do with the type of question that she is asking that the supervisor either doesn't know or doesn't think is relevant to what's going on in the lab, right? So, or it may be an orientation to the lab problem that the student wasn't properly oriented in the first place, so doesn't actually know what the work expectations are and stuff like that. So we need a lot more information, and then ideally we would sit down with both of them in some format and facilitate some kind of an exchange.
Okay, great. Thank you so much, Rob. So we are getting close to the session. Salim, your time to wrap up. Thank you.
Great. So can Heather please put on the last slide or the slides? While that's going on, I'll just say that it's interesting, this this notion of not presuming and all that. I think it's really good, and I'm good with it. The only thing that I would say is if I think we have to also not presume that the system is perfect or that the system is good. That there may also be problems there as well, to be humble to that. I'll give you an example, and Leslie may not like what I'm about to say, but I don't feel ethically good to tell a student who comes to me with something. I always send them to the right place and everything, but I don't feel ethically good to tell them that the system is likely to work well. I feel like they must know that that it's an imperfect system as well. Let's see.
I don't know what systems you're talking about, Salim, but all our systems work perfectly.
Absolutely. Can we go to the slide before this? Thank you. The one before that then. Yeah, so this is what I wanted to sort of wrap up with, which is I've sort of been thinking about EDI, and one of the things that that I think about is how to classify and think about it. And I think the best way is to think about the formal curriculum, the hidden curriculum, and the informal curriculum. So the example that we've been discussing is really about the learning environment, and that's really the informal curriculum. And there's a whole skills there that we can build in allyship, in understanding microaggressions, in understanding and debriefing the subtle example that was given here. But then there's also the formal curriculum, and students have brought up points here very much in the last few months, which I think are very valid. An example is when you're in journal club and you hear about, I'll just use the very cliche example of race and hypertension, and sort of you hear about race being a risk factor in hypertension, and is it really race? Is that really the right way to say it? Should we be saying experiencing discrimination as a racialized person, or should we be saying being racialized as, which is sounds like it's words, but it's actually important because it sort of situates the problem within the person's social relationship to society rather than within themselves. And then finally, there's issues like the hidden curriculum. What kind of structures and supports do we have for racialized students? Do we come clean and tell them that they might need more help because the system is less perfect for them, or do we try and build better systems? And here, I think processes of student selection are also part of that as well. So diversifying the workforce. If you look at the anti-racism plan that's that our office put out, it's a framework. It's going to be worked into a plan. This is really the organization of the different actions, formal curriculum, informal curriculum, and hidden curriculum. And with that, I will go to the last slide and say thank you. Thank you very much for having me. I feel like it was just a little soupçon for you, but if there are any burning questions and any time to take one, I won't manage it because I know that I know that I could just go on and on. But is there anyone that wants to ask me a question?
So I know, Salim, there was lots of questions for you which came in advance as well. So
Yes.
what I'm going to say, first of all, if I'm not hearing a sort of a quick burning question, because we like our 1 o'clock, sort of shut down. So the thing is, I can't thank you enough, Salim and Nicole. I think it was a very interesting topic, very much needed, very important. As you see, there's lots and lots of interest. I think so much interest, I'm already going to make a prediction. I see that you will be coming back is a sort of with popular demand for another session next semester is what I'm expecting. You had a lot of questions on microaggressions. You had a lot of questions, which I think is very important. And also, what is the proper nomenclature? How do we refer to different subgroups? I see these are very important burning questions that many people have. So I want to thank you so much for everything for it. Some of the questions that were already put forward, we're going to forward to you and Nicole, so you can answer some of the questions that we can then post them also on the Academic Affairs webpage, where we have everything linked with these sessions. So we post your slides and we also post like a short summary of the discussion. So for that, we'll also put some reading literature which you recommend and things linked with that. But I guarantee we will bring you back by popular demand.
It'll be my pleasure to return, and skill building is a big part of what we want to try and do in the SACE office. So that's definitely something that we'll do.
And then I just want to announce, sort of make an apology first, because apparently there was some issues with Zoom links. So we apologize for that. We have no idea what happened, but we're going to make sure that's totally under control again for the next time, because we don't want to send people to wrong locations. And just to let you know that November 18th is our next one, which at the moment, the current title is Virtual Teaching, Virtual Clinical Work, Virtual Research and Graduate Student Training, Lessons Learned and Adjusting as we Go, which I think is also very important. And Amy Ryan will be reading that session. So I look forward to seeing you again in the next few weeks. In the meantime, please everybody stay safe and enjoy the Indian summer, which is coming in the next few days.
Okay, thank you. Thank you, Salim. Great to see everyone.